Hi, I'm Dr. Julie Steinauer, and today we're going to talk about eye turns or strabismus surgery. I'm going to use this ball to kind of help us get a visual of what the muscles on the eyes kind of tend to do. So for our purposes today, we're going to talk about a couple muscles. There's a muscle up, down, to the sides, and kind of at diagonal. And what we want to think about in most surgeries for eye turns, we usually have an eye that's turning in or an eye that's turning out. So we're usually talking about the muscles on the side here. When we have an eye turn surgery, we either will cut a chunk of a muscle out or we'll lengthen one and make it longer in order to allow the eye to line up properly. The problem with that, which is a couple things, but one of them is that when you do that, you have to be really very precise and accurate, because these other muscles, especially the ones at the angles, will tend to cause problems. And frequently post-surgery for strabismus or eye turns, what we end up seeing is maybe this part of it, the alignment in or out, got corrected, but we'll see an upward eye turn or what's called a cyclotorsion, which is really tricky. And that kind of makes the eyeball rotate up and spin at an angle. And so those are things that are extremely common. I would say in most surgeries that ends up happening post-surgery, seeing an upward or a cyclotorsion version. And those are very tricky to deal with. So the biggest problems with strabismus and eye turn surgery, it's tricky to get everything totally accurate and not cause the eye to turn upward or cyclotort, especially after you have what we would consider the normal healing process, where the muscles will actually tend to lay a little scar tissue around them, and that can actually cause contraction and pull the eye up in those positions. So that's one thing. The second thing is that actually the brain is the control center and not the muscles. Everyone says it's the muscles, but it's not the muscles. So if you're only affecting the muscles, then the problem is you haven't treated the brain, which is controlling them. And after surgery, you might have an eye that had turned in, line up straight, but maybe a little torted up. And then whenever the eye heals and all of the muscles heal and that contraction kind of goes away, you may still have that upward eye turn, but then the brain may actually put that eye back in again over time, just because that's the way it's learned things to be. For more information about strabismus surgery and other options for eye turn surgery, go to visionforlifeworks.com. Thank you.